Again, welcome. And so just a note, every presentation that we're going to have in here is going to be recorded. The whole event is going to be recorded, and you'll be having access via our Florida Asthma Coalition website and our YouTube channel. So don't fret about it. Everything is going to be there. And if during the event and all the presentations, if you have a question we cannot get to it, please email it to us and they will be answered. So I'm here on behalf of my employer, the Department of Health and the Florida Asthma Program. And so we're going to talk about what's going on in Florida with asthma. So the Florida Asthma Program, we're going to talk about the Florida Asthma Program, the Exhale strategies, the asthma profile, asthma burden, and the Florida Asthma Coalition. So the Florida Asthma Program coordinates statewide efforts to reduce poor health outcomes due to asthma and hospitalization rates, and as well increase the number of people with asthma receiving self-management education. We are funded through the Centers of Disease Control and Prevention, the CDC. This is a grant for 5 years. We started in 2019 and we'll end next year. So we are right now on year number 4. September 1st, we start year 5 and we'll apply. And this is a competitive agreement. So with everybody else that will apply, and hopefully we will get 5 more years next year. So the Florida Asthma Program, through the funding, we fund 4 counties where we do lots of asthma education. We have the home visiting program. We have their mentors also for all the asthma friendly programs, specifically for school and childcare centers. So Miami-Dade, Orange, Seminole, and Gadsden County. Orange and Seminole, they're my extended tentacles, and we actually serve Polk County, Lake, Osceola, Volusia, and Brevard. So we extend those places. In Miami-Dade, most of our home visits and everything we do is conducted in Spanish. 95% of all the home visits that we have done, they're for our Hispanic Latino population. We have partners with lots of people. We have partnered with Nicholas Children's Hospital in Miami, Nemours Children's Hospital Health in Orlando, Simply Health, Sunshine Health, and CMS Children's Medical Service Title V. The Exhale guidelines, this came out about 4 years ago. We have been doing this forever, but I guess the CDC wanted a nice acronym, and so this is it. So we do education on asthma self-management. That's our core here. We also talk about extinguishing smoking and secondhand smoking. We partner with our sister bureau of the Tobacco-Free Florida and the local AHEX for secondhand smoking and smoking education and quitting services. Home visits, we do a lot of home visits. Since 2020, we have done more than 200 virtual and in-person home visits. These are 3 visits that we do every at least 2 weeks, where we go to the people's homes and we talk about anything about asthma management, from medication adherence, medication technique, asthma action plans, you name it. We talk about everything in there, and trigger management. The achievement is guidelines-based medical management. We do that, and linkages. This is one of the parts of coordinating care across settings, and the environmental policies. We do also various situations, for environmental health, which is so important. People sometimes don't realize that their environment can, obviously make you sick. One of the things that we did for the asthma-friendly childcare centers application, we actually instituted radon testing. Radon testing is mandatory in some counties and some not, but we wanted to educate radon, and it's just like, okay, radon, asthma, yeah, but it's still something that can lead to asthma symptoms if the radon, and you will think, oh, Florida, we're floating in water, we're not having, yes, we could have radon situations in here. So things like that we just do with the environmental part. We have a Florida asthma profile for all those people that love data and numbers and statistics. We have the asthma profile. It's started measuring 2016. They do aggregate and stratified estimates providers by county, by age. I mean, you name it. You go there and you'll find all kind of data about asthma in Florida specifically. The most recent update was March this year. So the burden of asthma, it disproportionately impacts vulnerable, marginalized populations in Florida, such as children, women, low income and inner city residents, and community of color. So for the Florida asthma profile, in every data that we have several surveys that we get the information from. The Behavioral Risk Factor Surveillance System, the Florida Youth Tobacco Survey, the Asthma Callback Survey for adults and children, mandatory reports like for emergency department and hospital discharge data, transition from ICD-9 to ICD-10 that took effect in 2015. Asthma code now J45, previously it was 493, and chronic obstructive asthma removed from J45. So, and we also get statistics from the vital statistics mortality data. So I'm going to go through a lot of data here. You can see we have data, the most recent data from 2019. This is from the Florida Youth Tobacco Survey. And so we've seen, kind of a little kind of stable of the current and asthma prevalence. We have to think, and we have to know that this pandemic kind of askew every data that we have, because we know, as you know, I'm a respiratory therapist. I don't work in hospitals anymore, but I see data, and physicians and nurses, and everybody knew that asthma hospitalizations, emergency department visit, they went down to nothing basically during the pandemic. Several factors. It's being studied now. There's some people that they're just like studying what happened. So and you can find that. So it seems like the asthma kind of went down, but it's just because people were, I guess they were either afraid, or one of the things that we think that actually good things happen, people start taking their medication like they were supposed to do. So, you have a chronic condition, you use a medication, and people say, I want to get sick, I'm going to take my medication. So we think that that's, researchers think that that's one of the things that happen. Unfortunately, I have read studies that said that people, when they went to the hospital with an asthma exacerbation, they were almost at the doors, death doors. They waited almost to the last minute. And so we've seen, and you'll see it in a minute, asthma death went up significantly. Again, prevalence by gender. So you can see, obviously the Black population by genes and other social economical situations, they had the highest burden of asthma. And Hispanics, and we know that. Just a little, I always do the explanation what Hispanic and Latino, the difference is just language. Hispanics is everybody that speaks Espanol, Spanish. Latino includes our brothers and sisters from Brazil that speak Portuguese. That's it. That's the difference. People from Belize, they're in Central America, but they don't speak Spanish. They speak English. So they're not considered neither Hispanic or Latinos. So that's the difference. Among the Hispanic population and the Latino population, Puerto Ricans have the highest burden of asthma of all the minorities combined. Adult asthma, we know that it can, women actually, it starts like boys have more asthma than everybody when they're little, but then kind of transition in life. And then, so the women, we get, the asthma highest burden in here. You can see that. Here, I'm just going to go through very quickly. So asthma affects, we know that every age is not a childhood disease. It's something that happens up to 99 years old, just to put a number in there. And so we can see, females that had the highest, not male, and especially Black females. Education level. So in income level, as you can see in here too, the less educated people are, the less knowledge that they have on managing any chronic disease. Last weekend, I was in Orlando at the Florida Cafe event. It's just an event. It was the 25th anniversary for families with disabilities, and people came to my table for asthma, and it was amazing how people don't know how to treat their asthma, and they rely so much on albuterol, and they think it's addictive. And you've seen it like that. I mean, if you do asthma education, people's like, I'm trying to stay away from albuterol, and I'm waking up every night, and I just don't want to use it. And it was like, yeah, if you're waking every night, Houston, we have a problem in here. Your asthma is not controlled at all. So yeah, people need, and the education level, it's just, and it's a great effect in here. So it's economical too, status. So like you see in here, asthma adjusted ED visits per 100,000 population from 2017 to 2021. We see the 2020 down, and then we start picking up. Especially when we saw the Dr. Purpose, you can see the RSV wave. RSV, a trigger for people with asthma, so it is picking up again. Again, the age-adjusted ED visits, as you see, for gender, is kind of equal in here. Again, hospitalizations went down too, but during the pandemic, pretty sure that in the next few years we'll see it rising again. Hopefully not, but we'll do that. By age group, of course, that's one of the myths. People say, oh, just a child, my kid will outgrow it. Not really. And we'll continue. So you see, as teenage and adolescence, puberty goes, it kind of, all the stuff kind of gets under control. And then as people get older and they start picking habits like smoking and stuff like that, starts getting that. The death rate, it seems to kind of stable, but this is the graphic that it shocked me when I saw it, and I have to say something to my fabulous epidemiology team at the Bureau of Chronic Disease Prevention, Dr. Rodrigue Pierre and Kate Kazmierski. They're the ones that gave me all this data. And when I saw this 17 The last time I did this last year, it was 10. We went up to 7. I mean, 7. That's heartbreaking. Especially, with people that we know, and we have experienced the death of somebody that has passed away with asthma. Personally, I have a cousin that she died at 15 of an asthma exacerbation. So way too many. When this is something that you can control. As we have our exhibitors in here, we have plenty of medications. Back in that day, I'm dating myself. I told Dr. Salman yesterday, I go to the hospital because I'm asthmatic too. And the reason also that I became a respiratory therapist, because these people were my friends at the hospital every time. I was there, I lived in hospitals. And it was the 3 shots of epinephrine and then the atropine, climbing walls all over the place, and then throw me in that coop tent that I despise. Like, you don't know. Worse than cockroaches. That's, my horrible things. But anyhow, so we still need to do a lot of work on asthma. People don't take it seriously. They think it's a mental thing. Some people. So definitely we need to keep doing what we're doing, educate people that asthma can be controlled. You can have a normal, healthy life, even if you have asthma. You just have to own it. That I tell all my the people that I try to educate. Own it and get over the control here. So again, all the people out there in the virtual world, please join us. It's free for the Florida Asthma Coalition. We are welcome people from everywhere: physicians, respiratory therapists, nurses, pharmacists, public health educators or health educators, teachers, mom, dad, granny, everyone that have to deal with somebody that has asthma or themselves. We have the 4 asthma friendly recognition programs. The schools, the child care centers. In schools, it's been kind of hard to go back to schools and teach the children how to manage their asthma, but hopefully we'll go back. But we have nice courses from the American Lung Association, like Kicking Asthma and Open Airways for Asthma, to teach these children. In child care centers, we train the staff. Here in Lee County, Lee Health, Golisano, they're doing excellent jobs with child care centers. There's so many, and it's just so nice as a parent to go to, take my child that has asthma and go to a place that they know what to look for, and for asthma symptoms and follow-up care. We have primary care providers, hospitals, and coming soon, pharmacy. We're going to do community pharmacies where people get their prescriptions, and they're going to be educated in how to take these medications, and also kind of follow up on the prescriptions, because the physicians, and you put that prescription in there and they're like, no, it's okay. I'm going to take this from my friend Andrea Jensen. She's also an asthma educator, and she mentioned that the prednisone tablets, they're Satan little Tic Tacs. So yeah, they take that Medrol pack and they think they're cured, and they don't take all the medications. We know that. Again, so please join us. We have webinars, trainings, the summit, and so we have many partners that work with us. Again, from the EPA, from the Allergy and Asthma Network, from the Asthma and Allergy Foundation, from the National Environmental Education Foundation. All these people, we work just to get asthma under control. Any questions? If not, that's my smiling face in there. Thank you.
Wanda, that was fantastic. Thank you so much. We're running right on time, so I'm just going to give it right back over to you to introduce Dr. Ramirez.
Okay. Well, you'll see me and you'll hear me a lot. So I'm going to introduce you to somebody that I met online, like, you know, everybody here. And this morning I just met her in person. Dr. Nina Ramirez, it's a pediatric allergist, allergist and pulmonology specialist. She works in Southeast Florida, and she just kind of stumbled into our Florida Asthma Coalition, and she's just very excited. I love her passion. I love everything that she does, all her plans that she has with us, and she's like, I didn't know. She just told me again, I didn't know that you guys existed. You know, this is a nice place, you know, to be. And I want to tell all my colleagues that you guys are here and you're doing this wonderful job for asthma. So without further ado, Dr. Nina Ramirez, please come back in here.